Preoperative fluoroscopy with a marker board identifies the target level and entry points. Puncture is performed and a puncture needle is inserted. After removal of the needle, a guide wire is placed to establish a safe working pathway. Sequential dilators are then inserted over the guide wire. Soft tissues are gradually expanded from small to large diameters, allowing adequate exposure of the surgical area and creating a stable, minimally invasive access channel. The final dilator is retained, while the intermediate dilators are removed step by step, maintaining channel stability and providing optimal conditions for screw placement. Using dedicated insertion instruments, the screw is engaged via its hexagonal interface and advanced along the working channel. Cannulated pedicle screws are inserted over the guide wire, ensuring accurate positioning and gradual fixation. The same procedure is repeated to implant additional pedicle screws as required. Insert the cross rod gauge into the long arm screws to measure and confirm the required rod length. Use a tab breaker to remove the screw extension tabs, standardizing the screw profile. Rod insertion instruments are then assembled. The locking mechanism is preliminarily engaged, and the rod is inserted and temporarily secured. Screw the set screws into the pedicle screws sequentially using a single head plug driver. Tighten the set screws with the final locking instrument to complete the fixation. Distraction instruments are utilized to perform segmental distractions, restoring intervertebral height and achieving indirect decompression of the spinal canal. After satisfactory distraction, compression is applied across the segment. The pedicle screw rod system is tightened to correct vertebral displacement and restore spinal alignment. For conditions such as lumbar spondylolisthesis, dedicated reduction instruments are used with a working cannula to achieve vertebral reduction and precisely correct the slippage deformity. Once reduction is completed, final tightening of the entire construct is performed sequentially to enhance fixation strength and ensure overall stability of the screw rod system. After all fixation and reduction steps are completed, the fixation status is verified. Completing the entire minimally invasive internal fixation procedure.